This particular session has been organized by the Council of Governors of Kenya, the group that actually oversees all the operations behind the devolution of that was set out in our Constitution 2010. And therefore, it is important that the owners of this meeting actually welcome us to this meeting.
I want to speak about this year's devolution conference theme and why we borrowed it. For People for Prosperity is a theme that was carefully selected by the Council of Governors, Secretariat, and of course the larger planning team, basically to address the inequities that has been in this country, the region and above, for the last 1 year. All of us, if you come from this country, you know what happened last year. And because of the erosion of public trust, because of the voices of masses to be included in policy making, decision making, and the like, we thought that would position devolution as a catalyst for equity, inclusion, and social justice. There is no country without the voices of the people. There is no country without exercising high levels of equity, and there is no country without ensuring that there is inclusivity across, from the youth, marginalized communities, persons with disability, and of course the citizens of Kenya. And that's why we thought this time round, we need to involve the stakeholders across the civil society, public institutions, government institutions, and each and every person that would love to make a difference and change in this country. And all the conversations have been extremely very progressive. Coming back to this side event that is extremely very important and critical to us, advancing human rights and social justice through assistive technology and rehabilitative services is not only actually a theme, but it's a live theme that CHAI has lived to do. We have partnered with CHAI for the last 13 years since the advent of devolution in ensuring that we shape the agenda of the health system in this country. CHAI has walked this journey with us, and the successes that we drive and publicize today, we can actually attest, if not in every paragraph, in every line of the support that CHAI has given to us. I will first start with the assistive devices that has really progressed in all the counties. They have been in the forefront of ensuring equity and inclusion, in ensuring that assistive devices reach to the most vulnerable and those desire that. It is a program that has been running, and as we speak right now, we have an 80 scale program that is running with ourselves and CHAI throughout the country and throughout the 47 counties to ensure that we advance this.
We come here at a time where the World Health Organization estimates that at least 15% of the global population are persons with disabilities. This means that in our country, close to 6 million or 7 million could be having a disability, only that they have not been identified and have not been put or given the appropriate assistive technology devices that could help them live dignified and independent lives. In the area of visual impairment, we work with partners in ensuring that we identify disabilities early, assess and place so that we can reduce the number of children who have attained school-going age, yet they are not in schools. So through the 80 scale project, we have worked to ensure that one, through the society and its many years and experience of supporting the education system and a program that we did in the Kenya Integrated Education Program, we would have the right 80 brought in, and this has enabled the schools to begin to support learners, giving them quality, affordable education with the right resources and materials.
You know, the Constitution of Kenya 2010, the Persons with Disabilities Act of 2025, and the United Nations Convention on the Rights of Persons with Disabilities position assistive technology and rehabilitation as a human right. So when something is a right, it is not, you know, a routine thing that we gather here. We are coming here as human beings to address and say, how are we doing on this human rights issue? So as KEMSA, we recognize that inclusion must be systemic. That means making AT devices available, affordable, and accessible to all Kenyans who need them. So once you recognize by promulgation of the Constitution and the various acts that come from there, KEMSA has positioned itself and considered AT devices as you know, systemic approach. So our role in this journey is to ensure that the assistive devices reach every corner of the country reliably, efficiently, and sustainably.
Suffered polio when I was a baby, but as growing up, I could hear my parents asking themselves. I was a very valued child, so they were asked, what do we do with this girl? So mara wanasema daktari amesema hii mguu ikatwe waweke ingine. All those stories, and even in my young mind, I was find myself asking myself, if a leg is weak, does it really need to be cut? Anyway, eventually my father did his homework, and he finally landed what used to be called King George. And that is where my leg was not cut, but was fitted with the appropriate technology which helps me to move around. And from there, because I got a bit of technology, I was also able to go to school. And that is why I can stand in front of you here today as a doctor serving Kenyans, and especially Kenyan children. Please allow me. I've been here since Tuesday, and I've gone through a lot of struggles. I don't know, some of you have noticed, if you have gone to the toilets, unapanda stairs. Have you noticed? Mukienda kwa choo munapanda stairs. So am I supposed to enter that toilet? I went there, and I felt whoever brought these toilets around did not think about us. Please, next up, this be considered. The other thing I notice is, when you are walking around, you have to be specific. Like today when I came here, I wanted to enter through this door. And then nikapata hiyo mtaro hapo. So I'm being but we go around, enter through the other side. And the other thing is entering, by the time you come and enter these gates in this facility, you have to go through many gates. Nobody wants you to pass there. They want you to come out. Anakwambia toka utembe. So me naenda na make sure I'm showing my devices so that asiniambie nitoke nitembe, because nobody considered that people in disability need to be given easy access to this place.
As we move forward, two things are key. One is the awareness around disability and the awareness around assistive technology. Because I think we have not yet exhausted the comprehensive list of what assistive technology is, and match it with our healthcare system and our context on what exactly should we do to assist. I think there is still a lot of work there. But number two is the financing. Everything about healthcare falls and rises on the financing. That is assuming that your governance and your structure is already okay.
First of all, let me apologize to the lady who has just spoken about the last speaker who spoke, the lady, in terms of assistive devices and accessing facilities within DEFCON. I know as COG, we've actually put that in place. Probably the signage and the direction will have not been properly done, but we take note of that, and apologies for anything that has happened, and we are sorry for really what has happened to you. So in terms of what you've asked is, for us, we feel that we need to integrate rehabilitative services in all services that is offered in healthcare. And already we are doing that. And I know there was a directive some years back that when, for example, like you find somebody who has a disability, he cannot, as much as you want to come to a facility, you cannot be able to access services the right time because of some obstacles. And I know we've tried to streamline some of the needs that is required for a disabled person to basically access those health facilities. So what we are just advocating for is to ensure that we integrate rehabilitative services into all services so that we encourage everybody to make sure that they've accessed.
In the recent ministry's plan, strategic plan of 2023 to 2028, a lot has been highlighted on the provision of assistive technology and devices in our country. So what the ministry has been doing for the last 2 or 3 years, there is a budget that goes under the description of specialized learning resources and assistive devices and technologies that is sent or designated specifically for assistive technology and devices. And while this was happening even earlier, we established that the cost of devices and technologies was much higher than what the schools were receiving. And so for the last 2 years, we have been pooling the resources through the Kenya Institute of Special Education, and we have planned a phase, about a 3-phase step that will make sure that after 3 years, most of the learners at least have the basic technologies or devices that they would require to access education.
We are now talking about inclusive education. Most of the times, whenever you go to schools, you find that the deaf children are maybe put as a group, clustered in a group or units. So maybe class 1, class 2, class 3, someone is in class 1, class 2, and class 3 that mixed together in the same class, as opposed to the hearing who are clustered according to their different grades that they have. So you find that accessibility is a problem because of that. So there is also a lot of policy needs that we need to follow up to ensure that we specify where it fits into them so that training can be good. It begins at the family level, and also the teachers who teach the deaf are also supposed to be service providers and supposed to be sufficiently exposed so that they can teach.
We are looking at developing a life course approach where we work with our people from birth. We are able to look at how many children are born, and of those who are born, how many are deaf, so that we can be able to start the journey with them. For those who are born hearing, we are also looking at trying to look at the different stages of life which you are at risk as developing hearing loss. And that is mainly during the early childhood. So we are developing policies for early childhood education, screening in those sectors in the schools to identify children who might be having ear infections and other conditions that, such as measles and mumps, and treatment that exposes children to deafness, such as treatment for malaria, in order to be able to catch them early enough and rehabilitate them. 60% of children who are deaf are said to have suffered deafness from preventable causes. And so we want to also empower the teachers and empower the parents and the mothers from birth so that they can be able to know what could make my child become deaf and what could predispose this child and what can we do to support this child.
Recently, we are doing advocacy on inclusive education. So we were able to travel to very remote villages. There are people who are still crawling on their knees. There are children who are still waiting for wheelchairs to go to school. I have a child who is 15 years today who reported to school only last year after getting a wheelchair. So my question is, how can we upscale access to AT?
What is currently being done on the aspects of sexual and reproductive health among people living with disabilities. I happen to have done a small research in Moranga with my student, and it was really, really shocking on that particular aspect of sexual and reproductive health. Even to find out that the very same healthcare providers who are able to, who are probably expected to give assistance to these people, are the same very people that has got a very bad attitude towards people living with disabilities. Thank you.
And our strategy is to focus on community engagement. So community engagement, because we know that we need to be able to empower the members through advocacy, to be able to identify and to be able to know where these services are available. In this case, we mean that we want you to be able to screen in time, to be able to be empowered well enough to be able to identify this person has a disability, and then to refer them to the appropriate facilities.
Mine is to say, like, what we are currently doing is uniform across all over. Like, there is no specific consideration for rehabilitated people who requires rehabilitative service and the rest. So if there is a policy that has already been developed in sexual, like for example, sexual policies, then that means it has to be implemented across all sectors. And I know, like in hospitals, what we are basically enforcing is like there is a whole unit of gender-based violence, and probably even for rape and sexual harassment. And I know any patient or any client who actually come across such are basically reported there. Even in the police, we work in collaboration, and that means we also need to bring on board the community strongly. The community should also be very very vigilant around on what is actually happening around the vulnerables, because like you are their person, you are the person who should be also helping them to advocate.